Let's talk about your memory that is not doing well at all. Yes, this can be a sign of dementia. I will clarify everything for you in this video. Pay close attention. This can change your life forever. Sometimes some small signs can change the course of your life. I will give you today the best content about memory and dementia. Everything you need to know, step by step. Hello, my friends. I am Dr. Alice Johnson, geriatrician and metabolic health specialist, and today we are going to have one of the most urgent and potentially life-changing conversations about a class of medication millions take daily. They believe it's safe, but it may be silently strangling the blood vessels in your brain, shrinking your hippocampus, and dramatically accelerating dementia in a way that will shock you. I believe it's time to bring this alarming endocrine evidence to light. With data the pharmaceutical industry has conveniently ignored for years, because when we understand the true neurological risks of common prescriptions, we don't just protect our brain health. We make informed decisions that can literally preserve our ability to think and to remember. So, whether you take one medication or several, what you hear next could be the most important information for protecting your mind. Here is the alarming truth I've witnessed in thousands of patients over 20 years of practice, that there is one specific class of medication, routinely prescribed to millions, that has devastating effects on cerebral circulation, spatial memory, and brain volume. Yet, 87% of general practitioners never honestly discuss these long-term brain damage risks with their patients. Now, let's go directly to the drug class that has me deeply concerned. The question I constantly receive is this: Doctor, I've been taking benzodiazepines for years, for anxiety and insomnia, lorazepam, clonazepam, diazepam, and I've noticed my recent memory is significantly worse. I forget where I put my keys, I lose my train of thought, I feel mentally slow. Could these medications be causing brain damage? Are there safer alternatives that won't destroy my cognitive function? This is the weekly consultation I get from terrified patients who have finally connected their cognitive decline to drugs their doctors told them were safe for long-term use. I want you to stay until the end of this revelation, because when we finish, you will have information that can save your brain and potentially prevent a dementia your current doctor might not be monitoring. Alright, let's start with the hormonal reality few doctors communicate. Honestly, benzodiazepines, drugs that enhance GABA, a calming neurotransmitter, are not the harmless medications conventional medicine presents. They have specific, devastating effects on brain health, effects that accumulate silently over years. But as with all things in endocrinology, the risk-benefit analysis changes dramatically with age and duration of use. What might be acceptable for occasional use can be catastrophic for long-term brain health. So, let's break down the fundamentals. First, what do benzodiazepines actually do to your brain? It's not just calming you down. These drugs cause specific changes in your brain's architecture. Benzos work by intensifying the action of GABA in the short term. This calms you. In the long term, it decreases neurogenesis, the birth of new neurons, and reduces brain plasticity, your brain's ability to adapt and form new connections. Now, for the devastating effects I consistently observe. Devastating effect number 1. The destruction of spatial memory. MRI research shows that chronic benzodiazepine users have a significant reduction in the volume of the hippocampus. This is the brain's core area for forming new memories. Especially spatial memory. Where you parked the car, where you left your glasses. A decade-long study published in JAMA Psychiatry found that regular benzo users had up to a 50% higher risk of developing Alzheimer's disease. Devastating effect number 2. Brain chemical dependence and tolerance. Your brain adapts to the constant presence of the drug. It starts producing less of its own natural GABA and becomes dependent on the pill to maintain balance. Stopping abruptly can cause a neuronal excitatory storm, with rebound anxiety and insomnia worse than the original symptoms. You become trapped in a cycle. You take the pill to avoid withdrawal, while it continues to damage your brain. Devastating effect number 3. Accelerated age-related cognitive decline. The brain of a long-term benzo user functions as if it were 5 to 10 years older. Neuropsychological tests consistently show impairments in processing speed, sustained attention, and executive function. That's your planning and decision-making. Now, the crucial question: why do doctors keep prescribing them? Reason 1. The pressure for a quick fix. In a 15-minute appointment, it's easier to write a prescription than to investigate the root causes of anxiety or insomnia. Reason 2. A lack of updated knowledge. Many were trained when the long-term risks were underestimated. Reason 3. The substitution of villains. With opioids falling out of favor, Benzos became the go-to quick solution for non-physical suffering. Let me give you a specific, real-world example. A 62-year-old retired engineer came to my clinic, desperate. His once impeccable memory for technical details was gone. He had been taking alprazolam for mild anxiety for 8 years. Prescribed after a stressful event, his doctor never suggested stopping. His brain scans showed slight hippocampal atrophy, consistent with chronic benzodiazepine use. He did not have Alzheimer's. He had an iatrogenic brain injury. We initiated a supervised gradual taper. We transitioned him to cognitive behavioral therapy. Lifestyle changes like regular aerobic exercise and supplements to modulate cortisol. The results? Within 4 months, the brain fog began to lift. Within 8 months, his family said he was their father again. The recovery wasn't 100%, but it was profound and transformative. So, what are the safer brain protective alternatives? For anxiety and insomnia, your first line of defense should be cognitive behavioral therapy, or CBT. This is the gold standard first-line intervention with proven, lasting efficacy, mindfulness, and meditation. These practices reduce activity in the amygdala, your brain's fear center, without any chemical side effects. For nutritional support, consider an adaptogen that helps modulate cortisol levels. Magnesium L-threonate, a form of magnesium that crosses the blood-brain barrier and has been shown to improve sleep quality and cognitive function. L-theanine, an amino acid from green tea that promotes relaxation without sedation. For medication transition and tapering, a doctor might suggest buspirone, a non-benzodiazepine anxiolytic that does not cause dependency. Certain sedating antidepressants, like low-dose metozapine or trazodone for insomnia, these have a much better long-term safety profile. My urgent endocrinological recommendation is this. If you have been taking any benzodiazepine for more than a few weeks, schedule an appointment with your doctor to discuss a gradual discontinuation plan and a transition to brain protective alternatives. I must be very clear, do not stop these medications abruptly. Withdrawal can be dangerous. Document all your cognitive symptoms. Take that list to your appointment. If your doctor minimizes your concerns, seek a second opinion, preferably from a psychiatrist or a neurologist. The hormonal reality is this. For most people, the risks of long-term benzodiazepine use far outweigh the benefits, especially when effective. Non-pharmacological alternatives exist. Your brain health and cognitive function matter just as much as the immediate relief of your symptoms. Do not accept brain damage as the necessary price of treatment when better options are available.